yard? Is it vineyard? Then you're testifying on.
I am testifying for 1139, but I am for both bills.
Okay. Tell us who you represent.
I represent myself, and my name is Sherilyn Vineyard, and I live in Pflugerville. I'm the mother of three, a newborn, a toddler, and a 12-year-old. I'm a cake decorator, and I do not have a commercial kitchen to work from. I began out of culinary school at the age of 20. My first job was in the mid-90s as pastry chef at the original Mezzaluna, if y'all remember that, in downtown Austin. In 1998, I had a daughter who at 13 months old was shaken by her licensed daycare provider and left with multiple disabilities and the cognitive age of 1 year old. I stay home with her and my two boys. My husband and I find it unacceptable to place her in a home. To work from home would mean being able to help support our family as my daughter's needs grow. She'll be losing and has already lost a lot of funding from the state for some of her therapies. With the Texas Medicaid waiver programs, she's actually been on programs that she's improved quite a bit from. Last fall, some of her funding was cut, and this spring completely dropped. We're not sure we can afford her therapy after this spring, as we've kind of maxed out our accessible resources. If I could just pick up 1 to 2 wedding cakes a month, we could pay for the unfunded therapy as well as pay for the eliminated and reduced equipment and supplies that help her function every day. With this legislative session threatening to end many of her important services due to the necessary cuts, I'm praying this bill comes through. I know that there are hundreds of other stories that are more compelling than ours. I know a woman who's supporting her children solely out of the home with big goods after being widowed. She lives in constant fear of being shut down or even worse, not being able to purchase insurance like legal operations can, risking a home and everything she's worked for being taken away. You may wonder why she doesn't just build or rent a commercial kitchen. Building or converting a kitchen would mean $15,000 to $20,000 in cash or taking out loans in an unpredictable economic climate with no business during some months. Renting a kitchen can cost upwards of $600 per month and faces the same problem as those slow months. Renting a kitchen, if I could find an affordable kitchen to rent, chances are that it would be less clean than my own. Having worked in many A-rated commercial kitchens, I can tell you that none of them were as clean as my kitchen, and some of them were actually dirty. I would not sell something to the public that I would not feed my own children, and that makes me even more conscious of how clean my kitchen is. When I was speaking to someone about this bill, they asked me how they could know that a cottage food kitchen was safe to eat from. And I told them if they had a concern, they could ask for the kitchen in question. If they were told no, then simply don't get anything from that kitchen. It's as simple as that. The presence of a health department grade does not guarantee that a kitchen is food safe, and the lack of one does not mean that it isn't food safe. I'm asking you to give Texans the choice of where they want to purchase their food. The supporters of this bill are from all walks of life. We make jams, jellies, breads, cookies, cupcakes, and cakes, and sauerkraut. And often the caliber of our product that comes from our kitchens far surpasses what is available through commercial kitchens. We ask you for the opportunity to share our talents with others and help our families at the same time. I ask you to vote yes to HB 1139 or 2084 to help the Texas economy, the individual Texans, and most importantly to me, my daughter, Aubrey Jean. Thank you for your valuable time, your enduring, especially today, service, and the opportunity to share my story and hopes for this bill. Thank you.
Quick question. 50,000 gross revenue too low?
Well, I agree with not putting a number on it only because I don't think I could make $50,000 come out of my tiny little kitchen. It's just, to make an operation like that, you need a commercial kitchen. So that's for me personally, but some people could probably do a little bit more.
Okay.
So it's kind of hard to,
Yeah. Well, we had 250,000, I think.
I thought that was, fine.
Thank you. Paige Hill.
Yeah.
Representatives, I'm so excited that you're all still here and so alert. I'm amazed that you called me just now because I came racing in on my scooter. And I watched the whole raw milk conversation, and you were equally alert, and I'm impressed. I am Paige Hill. I run an urban farming nonprofit called Urban Patchwork Neighborhood Farms. It started a couple of years ago, recognizing that we needed to fill in the gaps of our food system so that urban residents could get immediate and healthy access to foods that are not available sometimes in our current food system. In some economies in our urban setting, that includes prepared and preserved foods because part of, excuse me, I was running up Congress Avenue to get through the door. Because in the urban lifestyle, people have a busy lifestyle.
Okay, which bill
Yes.
are you testing?
I am for 1139. Yes, thank you. I'm for it. I'm for all of them. So part of economic resilience is people's time value as well as their monetary value. So one of the things as farmers that we teach in our programs with young urban farmers is finding ways to make fresh foods available economically, but also working with the community to make prepared foods available, because a lot of folks are working, both parents are working full-time jobs, they're not able to stay at home, so they're paying for daycare, and to have another source of economic viability for folks in the home is an important element of our food system and our economy. So ways to make food affordable don't just map directly dollar to dollar, but they also map to saving time for parents who want to stay at home. Excuse me. I'm still
You were running.
still coming back from running. And spending time with family members, and also in the community setting, being able to make extra money by selling products that you make safely at home directly to your neighbors. And one thing that we work with on our small co-op farms, neighborhood-based farms, is developing a food culture again, and combating the food culture that we currently have in a lot of urban systems, which is strictly fast food culture and convenience store culture. So when folks are making foods again at home and selling within the neighborhoods and creating a local economy again, we're creating a new food culture that reflects health and wellness and community. So that's what I'm here to talk about tonight, and to ask you to support is health and wellness and community and local economies that are sustainable. Thank you.
Thank you. Are there any questions? Thank you very much.
Thank you.